My name is Mitsuo Tomita. I'm a retired family practice physician. My career was at Kaiser in San Diego, I've been a volunteer with Compassion and Choices since it started, so it's been 25 years. In my professional career and even training, it was clear to me that we were not dealing with dying patients well. And I was happy, pleased that Oregon passed a medical aid in dying law about 30 years ago, and the similar one here in California about 10 years ago, because having options and choices at the end of life, having hospice and other types of care is, I think, so important. I mean, we plan for our careers, our what you want to wear, where you want to go, but planning about something that is inevitable and can be a surprise is end of life. And an advance directive, which is free. You can express what you want if you ended up in the hospital with a condition which is serious and life-threatening. So I'm Japanese American, and again within this Asian Pacific Islander. Those are complicated cultures, and each one has their own uniqueness, as does the medical culture, which I think I most identify with. And so the medical culture wants to do whatever they can to keep you alive. And advances in medicine have made it maybe more of a challenge to know, are you saving a life or delaying a death or prolonging dying? Well, I think the choice of medical aid in dying is something that most people are not aware of. Again, I live in California, and I think the surveys have shown that only about 1 in 4 even know that medical aid in dying, which has again been available in Oregon for about 30 years, is just not understood and a choice. End-of-life care, I think, mainly of hospice, and there's again a lot of baggage with hospice, but that's designed to improve the quality of end-of-life, making it a much more enriched experience rather than pain and suffering. So hospice is something that people should take good advantage of. But end-of-life and choices, again, is something that doctors are very reluctant to discuss, because their goals are to try to keep you living as long as possible. So doctors are not going to bring up hospice or end-of-life choices. It's something the public needs to know more about. Well, again, both, I think, professionally as a physician and then someone who has had many very difficult cases, it's important to have reflections and discussions ahead of time. You plan for, again, what you want to wear, your travel, things of that sort, but this is a difficult topic that is hard for people to get their arms around. Well, the challenges are, again, the lack of knowledge of these choices. So how to outreach to communities which don't want to talk about death and dying. That's a very taboo topic. So trying to educate, inform members of the various Asian Pacific Islander, Native Hawaiian communities that they have choices. Now again, cultures, again, within the Asian cultures, there are so many. I think those cultures kind of narrow down to your immediate family, your spouse, your parents, your kids, close friends, your church. What is your close community, your tribe? My tribe, I think, believes that individuals should have control over the end of their life. They should have autonomy. And I think many people involved in the compassion choices really put value upon control and autonomy.